Hello, my name is Anthony. I am a dentist.
Hi, I am an Asian. My name is Brian Jason II, but you can call me BJ for short. My tooth hurts. I think I have a cavity.
Okay, I will perform a cavity search. Looking at these X-rays, your 46 molar has significant decay on its mesial and distal interproximal margins, which extends onto the occlusal surface.
I only understood 4 of those words. What does that mean?
I am a dentist. You should just blindly trust my professional judgment. I am now going to cut your tooth. Okay, I have now prepared your tooth.
Ouch. I thought you were supposed to use anesthetic.
Whatever doesn't kill you makes you stronger, princess. Now I must restore your tooth. I will restore the form, function, and aesthetics of your dentition using a natural, non-toxic metal alloy called amalgam.
How will you get the contour and shape of the normal tooth after having unnecessarily cut so much of it away?
I will use a TOEFL matrix band.
What the heck is that?
A TOEFL matrix band is a metal band that is fastened around the crown of the tooth using an instrument called a retainer. The matrix band is threaded through the matrix retainer in this way. The matrix band has to be positioned in the retainer in such a way to not hurt the patient much. The lawn axis. The lawn axis of the retainer must always be facing anteriorly in the patient's mouth, or the patient will gag. The TOEFL matrix band is fastened and locked using the outer nut of the matrix retainer. After, the TOEFL matrix band is rounded with a rounded instrument. This is to shape the matrix band into something that can wrap around the tooth. One must be careful when mounting the matrix band into the retainer to provide enough matrix length to wrap the tooth.
Okay. What next?
After the matrix band is adapted for the tooth, we mount it on the tooth like this.
Wow! That is absolutely fascinating.
The matrix band is placed in such a way that the side with the small circumference is gingival and that the larger circumference is toward the occlusal. It's important to note that the upside-down U portion of the retainer must be oriented toward the gingiva. After the band is placed, we use the inner nut of the matrix retainer to fasten it to the tooth.
Okay, then what?
I will place something called a wedge interproximally like so. The point of the wedge is to create a gingival seal along the margin of the preparation to prevent gingival overhang. We also use the wedge to stabilize the matrix band and to create room for a contact with the adjacent tooth. Otherwise, when the matrix band is removed, a space equaling the thickness of the matrix band would be present and a tight contact would be impossible.
So the wedge is just to make everything nicer?
No, the wedge also serves to decrease blood flow to the gingiva, so your periodontally diseased gums won't bleed all over my bare hands.
My gums bleed a lot when I eat.
After the matrix band is in place and stabilized with a wedge, the matrix band is burnished with a burnisher in order to create an appropriate contact with the adjacent tooth. This also helps to create a more physiologic contour. After our amalgam is packed in, the matrix band is not simply removed from the occlusal. The matrix retainer is removed, and the band is cut such that each side can be teased out gently interproximally.
Okay. Thank you for the explanation. It was very interesting. Now are you finally going to fix my tooth?
I'm sorry. I will now pack amalgam into your mouth.
Wait. Doesn't that cause autism?
Yes. I guess I could give you a safer white composite filling instead.
But doctor, wouldn't that require a different matrix band technique?
Time. Yes, we will have to change our matrix band technique. Because we don't pack composite, we place it. We have to use a pre-contoured sectional matrix band instead.
Do it now.
I will select a matrix band size suitable for the tooth we are restoring. These come packaged in various sizes such as small, medium, large and magnum.
My teeth are very small.
After we select the matrix size, we have to select a suitable wedge and apply the same technique used with amalgam matrix banding.
Why do we need a wedge?
Because, as I have previously said, we want to hold the matrix against the tooth being restored, create a good seal, and to prevent you from bleeding all over my expensive operatory. Also, in composite restorations, the wedge supports the V-ring, which is giving us the contour of our tooth.
Okay.
Anyway, we then add the V-ring to our sectional matrix.
So this will help me have nicer teeth?
The sectional matrix will help create a more physiologic contour of the tooth, and will help prevent micro-leakage and periodontal irritation.
But will my teeth be nicer? Because really that's all that matters.
Yes, the sectional matrix band helps to create a nice rounded contact that will contribute to a better aesthetic result.
So then you can just pack all the composite and then we are done?
Not exactly. After placing the composite, the matrix band and wedge cannot be removed immediately because the composite material will stick to the matrix band.
Oh God, that's terrible. What will you do?
I will remove the V-ring and slightly displace the matrix band while leaving the wedge in place to cure the composite. After the composite has been added to a sufficient depth, I will remove the matrix band.
And then I will be beautiful.
No, but you will have a purry mouth. That'll be $300, BJ.